Hello, everyone. As we're waiting for everyone to get signed in, you will see a poll. If you could fill it out as we get started, that'd be great. You can also drop into the chat where you're calling in from tonight if you'd like. While we wait, I would like to introduce myself. My name is Madison Burnett, and I'm a BCBA. I lead our professional development program, and I'll be supporting throughout the webinar tonight. In addition to that role, I work alongside other BCBAs on a clinician-led recruitment team, and I support in the effort of recruiting quality professionals to join our team. If you are interested in joining us, please indicate so in the post-webinar survey at the end of this webinar, or you can email careers@manhattanpsychologygroup.com. All right. On the next slide, you will see a little bit about Manhattan Psychology Group. We were established in 2011, and we've continued to grow our team consisting of skilled adult and child psychologists, neuropsychologists, behavior analysts, special educators, licensed social workers, and ABA therapists. As a team, we're committed to wraparound care, which includes our wide range of services, from mental health and testing to ABA and educational services. This holistic approach allows us to address various needs and challenges with compassion and care. We provide services to clients out of our Upper West Side and Long Island City offices, in home, school, and clinic-based settings, as well as through telehealth. Our team is committed to serving individuals, couples, and families of all ages in diverse settings. We're also pleased to offer these free monthly webinars for parents and professionals where we will continue to learn and foster meaningful connections. Our mission at MPG is to create a future where individuals and their families feel supported, connected, and empowered. And our mission is to provide a multidisciplinary, integrated support for individuals and their families who experience mental health, behavioral, and educational challenges. In an effort to stand by our mission and vision, we are thrilled to offer these free 20-minute phone consultations with our clinical team. You can schedule a time by visiting our website at www.manhattanpsychologygroup.com, or you can follow the link that I'll be putting in the chat momentarily. All right, on the next slide, you'll see some housekeeping information. This webinar is eligible for contact hours for New York State licensed psychologists and social workers. Karen, if you can click to the next slide, that'd be great.
Sorry, it's not working.
Oh, that's okay. Maybe it just needs time to load.
There we go.
Perfect, thanks. A link for the quiz regarding the content of the presentation tonight will be posted in the chat, and I will be also posting it on the calendar within the last 5 to 10 minutes of this presentation. As of January 1st, we have started charging a nominal fee for the continuing education certificates. This webinar is still free to attend, but there will be a $10 fee for psychologists and a $5 fee for social workers to obtain a contact hour certificate. We will be leaving the chat open tonight, but please post any questions you have in the Q&A so we can make sure that they are seen. Any questions that you have are welcome, and we will be reviewing them at the end of this presentation if there's time permitting. And now I am excited to introduce our speaker tonight. Dr. Karen Zurowick is a New York and New Jersey state licensed psychologist. She has extensive experience in managing and participating in interdisciplinary testing teams to diagnose autism, ADHD, learning disorders, and intellectual disabilities. She specializes in differential diagnosis and hard-to-diagnose children under 5 years old and tests children and adults of all ages. She has extensive experience in the LGBTQ community and works with individuals regarding sexual identity, gender identity and expression, coming out, managing internalized homophobia, and transgender issues. She provides LGBTQ-informed therapy to assist with family difficulties, relationships, and co-occurring emotional disorders. Karen brings her experiences and talents to provide a comprehensive and cultural sensitive evidence-based therapies to Manhattan Psychology Group, which includes CBT, DBT, infant parent psychotherapy, compassion-focused therapy, and many more. And now, without further ado, I'll hand it over to Karen.
Thank you so much, Madison.
Of course.
Hi, everybody. So I'm going to be talking about, what are we going to be talking about tonight? So we're going to go over some foundational concepts regarding gender identity and sexual orientation. We're going to learn specifically about gender identity, and we're going to learn specifically about sexual orientation. And then we're going to talk about some things to look for when talking to teens, how to talk to teens. And then there's a ton of resources at the end. There's some really great like vocabulary lists and things like that. I know sometimes that people will have questions about like, what does this mean or that mean? But if I missed any words, let me know. I'll be happy to define anything. So let's get started. So, what is gender identity? So, gender identity refers to the the individual's deeply felt sense of being male or female. It's an internal understanding of one's gender. It may not align with their sex assigned at birth. So, gender identity is distinct from a biological sex, and it can exist along a spectrum. So, it's a social construct, and that's different than sexual orientation. So before I dive into sexual orientation, which we'll get into in a moment, I'm going to talk a little bit more about gender identity versus sex. So a lot of people get these two things mixed up and will say, well, what gender is your child? Or what gender do you go by? But the thing is that gender is a social construct. So we identify and we choose that to a certain degree, and we assign as a society roles and behaviors and expectations along two general poles of masculine and feminine, and then there's everything in between. So there's this construct of, there's gender toys that are typically for boys or colors for girls and things like that. So our society over time has developed these norms, and it's very much a social construct. So that's different than sex. So when we talk about sex, we're talking about the biological makeup of your body, your chromosomes. So that's something that you're born with. And so typically there are two general types of sex traits that you can have when you're born. Male, it's the chromosomes are XY, and female, it's XX. So we have those two things, but it's not always that simple because there are chromosomal variations that extend beyond this binary classification. So what that means is that in a sense, male and female are in a sense along a spectrum as well. So it's not always so black and white. So what do I mean by that? So not all individuals have these pairings of chromosomes. There are different variations in gene expression, hormone exposure during pregnancy and birth, and other biological factors that contribute to the sex of a child. So if we look from a biological standpoint, we have other variations. We have XXY, that is known as Klinefelter syndrome. So that's somebody who has an extra X chromosome, leading to a range of very specific physical features and reproductive differences, such as reduced testosterone production and possible fertility challenges. Now, can you tell what this person looks like on the outside? Usually, no. It's all of these chromosomal differences are really not detectable by like looking at somebody. Granted, there are certain physical characteristics that, are common with some of these genetic types of uh, chromosomes combinations, but for the most part, these are distinct chromosomal combinations that they just vary from the traditional male and female. So we also have the XYY syndrome. So that's males with an extra Y chromosome. So that would mean a higher than average, testosterone. So you can see that there are more than just XX and XY. So when we think about gender, which is a social construct, and all the variability with that, and then we think about the sex and the variability with that, we start to broaden our horizons and think that it's not so black or white. There's like more than two sides of the coin, so to say. So, like I said, I like to consider sex along a continuum in a sense because of all those other types of chromosomal differences that can occur. So that's very common. Somebody you work with, a child's friend, somebody else can have an extra Y chromosome, extra X chromosome. You don't know that. Unless you see their genome, but that's just something to keep in mind that it's not so black and white. So then let's get back to gender identity. So what is gender identity? So it's a deeply held belief and a sense of somebody's own gender. So uh, it may or may not align with their sex. So no matter your chromosome, XY, XX, XXY, XYY, whatever it is, we have that variability. And then we have how we want to present as gender of our identity. And now I say want to present. A lot of this is it's innate. A lot of it has to do with the hormonal things that are going on inside the person and what they're feeling pulled toward. I don't think many people sit down and say, today I want to be more male, or tomorrow I want to be more female, or the next day I want to be neither. There are factors beyond the conscious decision to identify as a certain gender. And it is influenced, of course, by psychological, social, culture factors, but also very personal factors as well. So when we talk about gender, there are some common terms. I'm sure everybody's heard of, or maybe not, and that's fine too. Cisgender. There's a lot of new terms out now. So if you're going to be talking to your kids or you're going to be talking to teens about gender identity, it's good to know these terms, and they're all in the PowerPoint. If anybody wants the PowerPoint after we're done, it'll be a great resource, and then you can refer back to it. Cisgender is somebody who identifies as their assigned sex. I'm female. I'm identifying as female. I'm a cisgender female. Now, had I decided to or felt compelled to have a different kind of presentation, if I was more masculine for any other reason, I would identify as something different. But a cisgender is somebody who's identifying as the sex that they were assigned. A transgender, we think of it as transition. So we say like trans male, transition to male, trans female, transition to female. We think of those as transitions, and that is originally one gender identity that has transitioned to another. So that can be a little bit confusing, and people will say, well, they're a trans male, female. I'm not sure what they are. And it can be really confusing. But if you think about it, like whatever they were originally, they transitioned to. So the trans is inserted before what they identify as now, as now. So then another term that is very common right now is non-binary. So that really means that somebody does not fit in strictly to either or. I'm pretty binary. I think I look female, I identify as female, and then there are men that identify as male. And so then that's the two ends of the binary extremes there. Now there's people that are non-binary. They're not going to identify strictly within those categories, within those social norms and those social constructs. They're somewhere in between, and that could be anywhere from like almost over here to male to almost over here to female and anywhere in between. And typically non-binary somebody will be kind of fixed at a certain point, like they'll be fixed at a certain point along that continuum. Gender fluid is not fixed. That means that it changes over time. Maybe at some point somebody feels a little bit more like they're female or male or non-binary, and there's some fluidity with that, and it can change over time. So that's what gender fluid means. Agender is a person who doesn't identify with any gender experience. They have a lack of gender identity. And so we have bigender, that's a person who identifies as two genders, either at the same time or at different times. We have something called two-spirit. That is often seen in indigenous cultures to describe a person who embodies both the masculine and the feminine spirits. That term has been around for a very, very long time, and it holds a special cultural meaning, and it's a special cultural role in the indigenous cultures. There's other terms like demi-boy, demi-girl. That's a person who is partially but not fully identifies as a male or a female, often feeling a certain connection to a certain gender, but it's not exclusive. And then there's androgynous. This often gets mixed up with agender. So androgynous is a gender expression that blends the two together. Somebody can be androgynous in how they look, how they behave, in a variety of ways. So an androgynous person may look a certain way, or they may act a certain way. I'll give you an example of that. So, you know, it's like I said before, I'm cisgender, I'm female, but there are some things that are androgynous about me. I like to do carpentry. I like to do kayaking and hiking. You know, those things that are typically attributed to male characteristics. So is there a facet of me that's androgynous? I don't know, you know. But so that's the extent of it for me, but other people, it can be that their characteristics, their presentation, their physical characteristics are a blend of male and female. And that's the male and female traditional societal norms for hair and makeup and clothing and all of those things. So we can have that kind of flexibility there with somebody who's androgynous. So these terms, they help people articulate their experience and identify themselves and give a broader understanding for other people to work with. Now we're going to talk a little bit about pronouns. So pronouns are really important because they're words used to refer to people in place of their names. I identify as she, her. And so other people will identify as he, him. Now there's, again, this whole spectrum of pronouns, and the using the correct pronoun is really important because it's a sign of respect for somebody and an acknowledgement of their identity. So I work with a lot of children and teens and even some adults who you know, are transgender, and one of the hardest things for them is accepting that somebody doesn't call them by their proper pronoun. Now that happens because anybody who's not an expert in this, which is most people, we're not quite sure how to use those words, and it's not second nature to us. So it could be clunky, you know, along the way as we're getting used to using pronouns. So when we start to understand and learn somebody's pronouns, then it's a good idea to at least try to practice it. And so that shows that you're respecting somebody's choice, of their identity and what they want to be labeled as. Now, this can be confusing because you know, when COVID happened and kids kind of like started Googling, you know, pronouns and identity and all these things, and it just became a you know, a rush of information, and they all studied up on this and learned all these pronouns, And then the rest of us who weren't investigating that were left in the dark. So there's some catching up to do. So it's not natural for a lot of people to use pronouns like they, them, or theirs. We're used to he, she, her. We're used to he, him, his. So it's, takes practice to get on board with they, them, and theirs. And talking to your child or a young person about, just being honest, like, this is new to me. This is something that I'm not familiar with. That's okay. Oh, I called you he, and you go by they. I'm so sorry. So, just being honest about it. It happens along the way. Just it takes some getting used to. That's totally understandable. So there are other pronouns. I don't hear these used as much. When these terms first kind of started surfacing, I heard them a little bit more, but I don't hear them as much. More so people will go with the he, him, or the she, her, or the they. But there are these other variations of pronouns that people will use, and they're all, very, very valid, and it's somebody's personal preference if they want to go by like z, zer, zers, and these are just different ways of saying their identity. So it's just it's a preference, it's a personal thing. And so it's always good to check with somebody about what their pronouns are. I like to put them at the end of my email so that people will know if, they're curious. And then it also shows kind of, I'm friendly and I'm open to, hearing what your pronouns are. So we talked a little bit about why pronouns matter, but the correct pronouns, it validates their identity and fosters inclusivity. So we're including them in our world. We're saying, yes, I accept you as you are identified, and that's okay with me. And I'm going to try to learn or get on board with, what pronoun you're choosing. So if you're unsure about it, like I said before, it is respectful to ask. It's okay. And then you can even introduce yourself with your pronouns, like I said, like I do on my email. And that really normalizes it. So let's go back to the sex area. We're going to talk about sexual orientation. So sexual orientation, a separate circle from gender identity and sex. So what is sexual orientation? Sexual orientation refers to a person's endearing emotional, romantic, or sexual attraction to others. And like I said, it's distinct from gender identity, and in that it's not something that a person chooses or can change. It's this innate feeling and this being that just is. It's not something that somebody can turn on or off. It's not something that someone can convert into a different one. It is as natural as the fact that, believe it or not, I don't like chocolate. I know it's weird, but some things we just can't help. I prefer vanilla. I don't know why, but we can't help these things. We like what we like. We have these feelings. They come from within, from our instincts, and they're not something that we can change unless they're changing on their own. So sometimes these things do shift within our lifetime. This can happen. People can come out later in life. People can change later in life, early in life. So these things are fluid in that it develops on its own. It's not something you can turn on or off. So if we, when talking to teens and talking to young folks about their sexuality, we want to understand the general terms. And most people have heard of a lot of these terms: heterosexual, Straight, that is the norm, the heteronormative, the heterosexual norm is what the majority of the population is. And then the homosexual, the gay, lesbian terms, those are used for people who are not heterosexual. And so then we have other variations. And so we have the term gay that is sometimes used for men. Sometimes women like to use it. Lesbian is a word that women use. I've never heard a man call themselves a lesbian, but it's perfectly fine if they do. Bisexual is something that somebody feels attracted to both sexes. And then we have pansexual, a person who is emotionally romantically attracted to somebody regardless of their gender. So you think of like, here's, I'm dating myself, Pan America, like the old like airlines, like around the world, anything, we'll go anywhere. This is that kind of like pan, all-encompassing type of sexuality, that there's just this attraction no matter what somebody else's gender is or their sex is. And so then we have asexual. It's also abbreviated as ACE. That's a person who experiences little or no sexual attraction to others. And that, exists on a spectrum as well. Some people will have zero interest in dating, in romantic relationships. Um, so, but an asexual person is strictly, they're not interested in sex. They may still engage in romantic relationships, but they're not interested in sex. So we also have terms like gray sexual, a term that's used in infrequent or situational attractions, or like demisexual, a person who only experiences sexual attraction after forming a romantic or a emotional bond with somebody. Queer is a term that is used across gays, lesbians, men, women. It's just a broad term used to describe people who are not heterosexual. And polysexual, it's a person who is attracted to multiple genders, but not necessarily all genders. So it's different than pansexuality. Pan is that all-encompassing sexuality. Then we have omnisexual, that's similar to pansexuality, but without the awareness or preference. Whoops, whoa, I'm sorry about that. That gender may play a role in the attraction. Okay, I got the slides under control here. Okay. Okay, so there's a couple more terms here, and I won't belabor this there, but if anybody has any questions at the end. Another one that you might hear a lot is aro or aromantic. That's what I was starting to talk about before. That's somebody who's not interested in romantic relationships, but they may still experience sexual attraction. And then there's questioning, people who are exploring, they're unsure, they're just really not sure where they're landing. They haven't landed on anything just yet. So let's put this all into perspective, because sexuality, let's face it, it has come and gone throughout the ages. Heterosexuality, homosexuality, bisexuality. As we look through history, it has come and gone as far as societal acceptance. It has been revered, it has been forbidden, it has been everything. So, as we can see, in ancient times, there were norms where it was really, very widely accepted. And then there were political and religious and other social reasons why it's come in and out of favor. And this has happened through time and, through the medieval ages and through colonialism. And, it's even been criminalized to be a homosexual it's been pathologized. It wasn't until like the 1970s and 80s that homosexuality actually came out of the Diagnostic and Statistical Manual of Mental Illnesses. Way back when, it was a mental illness because we didn't have an understanding of the natural components of this. We didn't really, we're at a time when it wasn't accepted. So it was condemned and people were hospitalized for it. And there were all sorts of horrible treatments and conversion therapies and all these kinds of things that went on. But again, luckily, throughout time, we've become more and more accepting, and we get to the turn of the century, and we finally have the legalization of same-sex marriage in the Netherlands. That was a landmark. And then all these anti-discrimination laws gain momentum, and then our society starts to embrace change and different ideas about coupling. And so now now I feel a shift coming about. There might be another shift coming about. But I think for the most part, in this day and age, we have a lot of knowledge, we have a lot of information. There's been a lot of research, and it's ongoing about different sexualities, different gender uh, identities, and so much information is present right now, no matter what anybody believes or what laws are or whatever. There's so much information. We can't unknow what has happened over the years. We can't unknow all of these different characteristics that people have. So it is present, whether or not it is accepted or not. But hopefully we're moving more toward wider acceptance. So, just a little tidbit of information. When we think about different species, homosexuality and non-heterosexuality is more common than you think. 1,500 species, including mammals, birds, and reptiles and insects, are not heterosexual. I find this fact so interesting because there's different types of relationships that other species form. Bonding, caring for young, hierarchy, reproductive strategies, bonobos, dolphins, birds, these all have same-sex pairings, and for certain reasons, for societal reasons, for other sorts of group inclusion reasons. And then there's certain fish and amphibians that can actually change their sex based on environmental factors. If certain fish can change or its sex changes based on the temperature and the needs, the reproductive needs of the species at that certain time. I just find that fascinating. And so this biological diversity suggests that not all heterosexual um, practices are in all species. So this is really a natural part of the cycle of life across species in our planet. I just find that really fascinating. So let's talk about one of the things that a lot of people in the LGBTQ community have to deal with, and that's homophobia. And so homophobia has an impact on individuals who are LGBTQ plus and who are not LGBTQ plus. So it can manifest itself in various ways, obviously outright violence, legal resistance, to subtle biases and microaggressions. There's something called institutional homophobia, and that includes discriminatory laws, workplace inequities, and a lack of LGBTQ plus representation in education and healthcare. So that could be something like there's no programs in certain hospitals for, gender affirming care, or, there's maybe a heteronormative uh, way of thinking or giving care in, say, an OBGYN clinic or something like that. So I have found that in our wonderful metropolitan area, there's so much variety and so much openness and acceptance that it's just a wonderful thing within the healthcare system. I think we're very fortunate to live in this area. And so back to homophobia. So that is the opposite of that acceptance is this fear. It is fear. It says phobia. So it's a fear of homosexuality. And oftentimes it's a fear because we don't know what it is. We're not used to it and it's uncomfortable to us. So homophobia can be overt and outright, somebody saying, I don't like somebody who's gay, or it can be that it's just a feeling. I've not been exposed to anybody like that. It feels unfamiliar to me. I'm not sure what to do. So if that's the case, that can be a very subtle form of homophobia, and someone may find themselves saying things that are heteronormative, that are offensive to LGBTQ plus, and that can be considered homophobia, even if it's not intentional. And a lot of it is just not understanding or not being around others. So there's just that lack of information about them, which can all be changed. You can always get more information and education if you're open to it. So another type of homophobia is internalized homophobia. And this is a very damaging phenomenon where an individual has internalized this. So we've taken whatever external homophobia has been experienced or presented, and we've internalized it. Now, what that means is that I no longer accept that in myself. I'm not okay with any ideas I might have about being gay or being lesbian or being queer. And it also goes with, transphobia as well. It's like somebody who's taken these societal views and internalized them. And so we see this sometimes in very, very young folks who have been exposed to a limited variety of these different cultures, and it's just a lack of familiarity. But then when you don't have that familiarity, you can start to feel like maybe there's something wrong about it because it's not common. So that's very common for kids to start to feel like there's something weird about them or there's something unusual because it's just not the norm around them. So if that happens, if somebody has this internalized homophobia, they're not going to feel comfortable to start to acknowledge that in their own selves, to explore that, and to start to share that with other people. So that leads to self-repression. And so then they're avoiding relationships and suppressing their identity due to fear or judgment. It also leads to anxiety and depression. It leads to overcompensation. So some people may try to fit into a heteronormative society or social structure or relationship when it's really not comfortable for them because they don't have a community that they can really relate to. And so then one of the things we often see that can be very damaging is just somebody who has this internalized homophobia, and it never is actualized or realized, and it comes out as bias toward others. So it would be some hate crimes, some things like that, where people are really adamant in judging about somebody else because of their homosexuality, when in fact it's their own homosexuality that they can't tolerate. So not only can they not tolerate it in themselves, they can't acknowledge it, but they can't even tolerate it in somebody else. So that's very, very deep. And that does cause a lot of damage. So overcoming this internalized homophobia requires a lot of self-acceptance, supportive communities, exposure to LGBTQ plus representation, so therapies and support groups that can help individuals unlearn these harmful beliefs and embrace their identity with pride. So I kind of touched on this before, that there are research studies that talk about the links between internalized homophobia and mental health. So we see increased anxiety, depression, low self-esteem, suicidal ideation. So there are significantly higher rates of depression and anxiety in people who have repressed their own identity. And this could lead to bigger health problems, chronic stress, emotional suppression, self-isolation, and all of those things contribute to poor mental health. So people who have internalized homophobia are at increased risk for many health problems. Okay, and this just kind of talks a little bit more of the impact um, on self-esteem and identity development. And so I want to draw to your attention to like the bottom part where it says internalized homophobia can cause individuals to reject or hide their identity and have their self-worth drop. And then, that have a hard time forming healthy relationships. And then there's all sorts of interpersonal difficulties and troubles. And so that can lead to people feeling like they're broken or there's something wrong with them. And that's a very difficult spiral to get into, which leads to depression, which leads to more low self-esteem. And it can be a vicious cycle and very difficult for somebody to get out of. There are other factors as well that compound uh, these stressors, minority stress. So there's research that says minorities are particularly at risk for lower self-esteem because of the compounded uh, homophobia and or transphobia and the minority stigma or status that they have and the oppression that they might feel. So individuals struggling are less with homophobia are less likely to seek therapy or support. So again, isolating themselves. And so then they also may struggle about opening up about their identity and having conversations with people. So how can we address this? We can address this in a couple of ways. Through therapy, there's professionals who can help individuals work through this internalized homophobia uh, or transphobia and build self-acceptance. There's LGBTQ plus support networks, so connecting with accepting communities can reduce feelings of isolation and reinforce the positive identity development. And then positive representation. So exposure to LGBTQ plus role models and media can challenge negative perceptions and normalize the diverse identities. So I'm going to talk a little bit about supporting teens and their exploration of gender and sexuality. So the first step as an adult in supporting a teen or a young person is to arm ourselves with information and education. So let's get some terms under our belt. Let's like read some information, get a little bit of uh, comfort with some of these terms so that we can at least begin to have a conversation with somebody. And it's fine to ask, what does that mean? Or I don't know what that is. That is totally fine. But it really is such an endearing thing for somebody to say, I'm trying to learn about this and I read about this and so bear with me as I'm learning. So the best thing you can do is start to educate, talk to friends, talk to, a therapist, somebody who has some knowledge of it, read some information, and then also examine your own biases. What has your own experience been? Have you had some negative experiences in the past that can really impact how you approach a young person who's exploring their gender identity or sexual orientation, especially depending on your history, your generation, and what other historical events you've been through. And um, so that can definitely impact our, approaching an individual who's exploring. So we want to start the conversation um, with a couple of things in mind. Ask open-ended questions. Like I said before, it's fine to admit, I've been reading about this. I want to make sure I understand it. It's okay. There's no shame in that. Asking somebody else, what are your thoughts on that? uh, Using media as a conversation starter. So watching TV shows with kids, movies, reading books, and these things could lead to natural discussion. You can have a discussion after reading a certain book or watching a certain movie. Again, asking their opinion. What do you think of this? Or, oh, that's interesting. I didn't know that. I just learned that today. So those are great ways to start conversations. And then just expressing unconditional support. So let the young people know that no matter what, you are there for them. You love them. You're going to support them, no matter what they identify as, no matter what their sexual preference is. Just let them know that this unconditional support, no matter what. That goes a very long way. And you may feel that and think that, and the child may know that on some level, but once you say it, it just lifts the burden. So it's okay to say it. So then also avoiding pressuring people to label themselves. So some adults get frustrated with young folks. Oh, I'm he today. Tomorrow I'm they. And next I am Z. I can't keep up with all of you and your pronouns, and it can get frustrating. So we don't want to do that. We don't want to pressure people. It is kind of hard to roll with this, but we do want to give this reaffirming, yes, this acceptance of, I accept what it is that you're telling me. Because if we don't, the pushback is only going to come after that. So it's best to open mind, non-judgmental acceptance, and just be supportive. So what are some signs your child might be exploring their gender or sexuality? So they might not always directly communicate their thoughts and their feelings to you. That's typical. But some things that you can look out for. So increased interest in LGBTQ topics. Maybe they engage with certain media, books, or online communities. Maybe they tell you about a certain podcast they're listening to. And you're like, is that LGBTQ plus? Okay, let's talk about that. The signs can be really subtle. So you can also see changes in their language or pronoun use. If a child comes to you and they've never used the word they or them, and all of a sudden they're saying, oh, my friend at school, they said this, or Z said that, then they're starting to become savvy with the words, and maybe they're just learning it, or maybe they're starting to question their own pronouns. So those are some signs. Expressing discomfort with gendered expectations. We see this a lot when this is years ago more so, but girls are told to wear dresses and boys are told to play with trucks, and they just don't want to do it. And so uh, we see now different hairstyles and activities that are not assigned to their gender, and they're expressing themselves in different types of ways. So if they start to experience or express discomfort with these expectations of their assigned sex, and they're really leaning toward a different identity, then that's okay. And that might mean that they're exploring. So they may also just outright ask questions about gender and sexuality. They may come to you and ask you, what is a pansexual? And read up on it. Or say, I don't know, let's look it up together. This is a learning experience for everybody, and that's okay. So you may see some changes in their social circles. They may lean away from one group of friends and start to gravitate toward another. That's a sign also that things may be shifting. And then sometimes we see mood shifts, anxiety related to identity, internal struggles, and then sometimes this can lead to emotional distress or withdrawal or increased self-reflection. So those are some of the signs. And so I'm going to go over quickly what is gender affirming care, because you'll probably see this in healthcare and just in general. And then we'll get to some Q&A after this. So gender affirming care refers to medical, psychological, and social support that helps transgender and non-binary individuals align with their physical and emotional well-being and their gender identity. So what does that mean? Well, there's many different kinds of gender affirming care. There's social affirmation. So that's non-medical, it's social, it's acceptance, it's choosing using the chosen pronouns, it's adopting the gender affirming hairstyles, clothing, it's accepting that. And it's people adjusting gender markers. So maybe, starting to change legal documents or birth certificates. These are all things that are socially changing. So if somebody wants to transition, or if they're transitioning from one sex to another, then you'll start to see these different levels of commitment to the process. So the first one is the social commitment to that process. Then there's the psychological care, so the gender affirming psychological care. So access to mental health care professionals who specialize in gender identity issues. So if your child needs a therapist, ask, are you familiar with LGBTQ plus issues? And you can ask specifically, are you familiar? Have you worked with teens who are trans male or trans female? That's certainly fine to ask. And then you can find family and peer support groups that can foster the understanding as well. So then when we go in more into this transition, a different level of care is medical care. So gender affirming care on a medical level looks like puberty blockers. So this is something that is a medication that will delay the natural puberty blossoming or onset. So that'll give young folks an opportunity to explore their identity before the permanent physical changes start to happen, before the breasts develop, before the mustache comes, before those telltale male or female things emerge hormonally. And then hormone replacement therapy is for transgender women, trans feminine individuals. That would be something like estrogen or anti-androgens that promote breast development and reduce facial body hair, facial and body hair. And for transgender men, that would be something like testosterone promotes voice deepening and muscle growth, and then it promotes facial hair. And so then the next level, as far as medical, would be surgical. So this is only for adults, older adolescents. There's a lot of debate as to what age it's okay to engage in these things, which I will not be covering here, but happy to talk about offline. So top surgery, bottom surgery, facial feminization and masculization surgeries are, available, and something that individuals may want to explore. And then lastly, legal and social advocacy. It's very important to get support if somebody wants to change their name or gender marker or on their legal documents. And then workplace, school, and healthcare protections to ensure gender affirming policies and practices. So, in a nutshell, it's important to practice gender affirming care because it reduces gender dysphoria, improves individuals' mental health, enhances their overall well-being, and it's all supported by extensive research. And it also reduces anxiety, depression, suicide risk. Okay, so I'm going to pause here. The rest of the slides are resources and terms, which I'm happy to share these with everybody, but I'm going to check in with Madison now and see if there are any questions.
Yeah, so if you could actually, as you flip through that, if whenever you finish flipping, if you could end on slide 49, that has a QR code for people to access the CEs, the post-webinar quizzes, and for their surveys and whatnot. I've
Yes.
also posted in the chat. So the first question is, as a therapist who writes progress notes, do I use the preferred name or the original name within a progress note? As well, which pronoun is appropriate to use?
I love this question. I love it. Okay, let me tell you a story. I was working with 16-year-old, and so it was hard for me at first to write. I'm part of the LGBTQ plus community, okay? So it took me a little while to get on board with the they them thing. Honestly, this was years ago, but it did. So I'm going to practice, okay? So my patient identifies as they. I'm going to practice. I practiced it, and somehow it came up in session. Um, yeah, well, I write your notes with they them. And they were in tears. They were literally in tears. They were like, thank you, thank you. That just meant like so much. So practice it, try it. Um, Go with what they say and roll with it and educate yourself and get some practice. That's what I suggest. Um, because using a non-preferred pronoun, although it may not mean a lot, what happens is that then those notes could be reviewed with parents and other people, and it can be viewed as non-affirming. So I say go with it.
Thank you. How do you navigate treatment with teens when parents are not in support or do not want us providing gender affirming care?
That's so tough. That's so tough. So, as a practitioner, as a therapist, somebody who's providing care, it is your ethical obligation to provide the best care. That first tenet, do no harm. So really, we can't not provide gender affirming care. Um, yeah, so we really can't not do it. But it's a very, very like delicate balance that we have to work with parents who are not on board with it. We have to make it clear to them that my first priority is your child. I am your child's therapist. You're coming to me for treatment. I can provide gender affirming care. This is my treatment approach. And I have told parents, the more we push against this and the more we reject it in the child, the more anxiety, the more depression, the more problems it's going to cause, suicidal ideation. I'm going to provide this. If you want to find a provider that's going to withhold gender affirming care from your child, I'm not the one for you. So I'm sorry if that's a little harsh, but that's kind of the stance that I take.
We did have an anonymous attendee ask how to handle if there's a request for more information. If that was your question, can you give a little bit more context? Karen, there's another question. I believe it might be about pronoun usage and desired name, the question that you answered previously. What about for official reports like neuropsychology assessments?
Another great question. I love it. So I have done reports with they, them. Now, this is, I want to ask, like, where is your patient? Where is your client? Where are they? The person that I wrote the report and they, them, they were experiencing extreme gender dysphoria and bullying. So it was very important for me to show that I understood them and that I used their preferred pronouns in an entire 50-page report. And I did. And that they read it and they saw that. And that was very important to them. Now, are there instances where you can use their birth sex? I tread lightly on that. If the child is very, very young and the parents are very, very adamant, and the child's not going to see the report, and you really want to be supportive of the parents, even if they're not ready to embrace it, they're not ready to accept it, they need more education, they need more information, then I might do it. But it really depends on the case.
Great. Okay, and then we did have time for a quick response for the clarification. So the question originally was, how do you handle if there's a request for information, such as if you use a new pronoun or a new name, and and that's how professionals and parents find out for possibly outing someone.
Okay, I'm going to ask for a little more clarification. So, how do we find out about the use of the pronouns, or how do we find out about whether or not we should use it to out someone?
I am not entirely sure.
Okay.
Um,
Okay.
I am going to end our recording now. If whoever posed that question, if you can provide even a little bit more context, that would be great.
Yeah.